Hi, my name's Ken Brannigan. I'm founder of Senior Healthcare Solutions. I'm sitting alongside my sister, Melissa McCalla. She's the owner of our agency and the leader of our team. She's taken a few minutes out of her busy schedule today to talk to us about people that are new to Medicare.
Right.
Yeah, because there's a lot going on for people that are new to Medicare. A lot of moving parts, and so that's what we're going to discuss today, right?
Correct.
You've given me a little punch list here to help make sure that I stay on track. I'm really good at shiny object syndrome. So grab a pen and paper. Today we're going to discuss, for those of you that are new to Medicare, we're going to talk about your eligibility and enrollment. We're going to talk about how to avoid penalties and how much you can expect to pay for Medicare and what your options are. This is all really important stuff. So again, grab that pen and paper and let's get
started.
Let's get started. Yeah, I like it. Let's hey, stop wasting my time here, would you, Ken?
Yeah.
All right, so let's talk about the eligibility. Who is eligible for Medicare?
So when you're eligible for Medicare, you're going to be turning 65. You have to be either turning 65 or over 65 to be eligible for Medicare. Or you can be under 65 if you've been on disability for 24 months, then typically you're automatically enrolled into Medicare.
Gotcha. So under 65, certain disabilities.
Correct.
Right? If you're turning 65, or you could be over 65 if you're still working and you decided to retire.
Correct.
Yeah, gotcha. So those are your three categories, right? And then when it comes to enrollment, tell us, some people aren't enrolled automatically.
Right. So when you're turning 65, if you are not drawing Social Security and you need to go onto Medicare, then you need to take it upon yourself and enroll in Medicare. You can do that by 3 easy ways. You can go to your local Social Security office, you can call, you can do it online, or 4 ways. You can fax or mail your paperwork into the Social Security office. If you are receiving Social Security and you're turning 65, you will automatically be enrolled in into Medicare, and you will receive your Medicare card about 3 months before your 65th birthday, 2 to 3 months before, just depending on how the government's working.
Gotcha. So if you are drawing Social Security benefits, if that's your group, then you are enrolled in Medicare automatically.
Correct. So if you are drawing Social Security, but you're going to continue to work and have group coverage and don't want to take Medicare, then you need to contact Social Security and let them know.
Gotcha. Yeah, makes sense. So I just know it seems like those are the questions I feel like you guys get a lot. And then people that don't enroll in time, we're going to talk about penalties, right? So maybe I'm getting too far ahead of myself, but let's explain, right? Like if they don't enroll in time, how does that impact?
If you don't enroll into your Medicare at the correct time, for your Part B, the government will penalize you 10% per calendar year for not having Part B coverage. So it's important to keep in mind that if you're turning 65 and you have no other health insurance options available to you, that you enroll into Medicare during that window of your 65th birthday, the 3 months before, the month of, or the 3 months after. Or if you're going to retire, you're over 65 and you're retiring, you do not want to waste too much time. 1, you'll have a lapse in health insurance coverage, but 2, you could also incur that Part B penalty by not enrolling in time. And that is not a one-time penalty. It's a penalty that keeps on coming every year.
It's Uncle Sam getting back at you. So that's why it's important to talk to Melissa and her team about when you should enroll, because paying Uncle Sam more than you need to,
it's just not fun.
It's just not fun, right? I hear that.
It doesn't make anybody happy in the retirement phase.
Right, and you brought up another great point though too, is that they could have a lapse in coverage.
Right, and you don't want to be without some insurance, that's for sure.
That would be my luck, right? That's when something's gonna happen. So make sure that you're enrolling in a timely manner to avoid penalties and avoid potential lapse in coverage. Okay, so let's talk about how much Medicare costs. What can people expect to pay for Medicare Part A and B?
So Medicare Part A, typically you don't pay a monthly premium if you have worked 40 quarters. So your Medicare Part A would be free. Medicare Part A, if you do have to pay a monthly premium, I believe it's $499, but there's very few percentage of people that actually pay a Part A premium. Now, when it comes to your Medicare Part B premium, the premium for that this year in 2023 is $164.90. And everybody pays the Part B premium. Doesn't matter who you are. Once you're going onto Medicare, you are going to be tacked on that Part B premium. You're either going to have it taken from your Social Security check if you are drawing Social Security, or you're going to get a bill from the government to mail in a check and pay your Part B premium. Your Part B premium can vary. If you have some level of assistance from your state, such as Medicaid, your Part B premium could be lower. Or if you have been fortunate enough to make above a certain income, your Part B premium could be higher as well. So there is an IRMAA charge where once again, Uncle Sam gets a little bit more money. So you always want to make sure if you think you're a higher income earner, then you want to check out and make sure what your Part B IRMAA cost would be.
So Part B premium could be higher because of a penalty.
Well, yeah, I mean, for making more money, yeah.
Or it could be for IRMAA.
Oh, or right.
So there's
right.
two instances, right? People could be paying more for Medicare Part B.
Yes, exactly.
Wow. So again, check with Melissa and her team. You want to be sure that you're not paying more than what you need to, right? So that's the cost of it. You mentioned that some people may pay more based on their higher income.
Correct.
Is there a situation in which people may pay less for their Part B premium based on their income?
Right. So that's when I was saying that depending if you get help from your state, if you're on Medicaid, then Medicaid may pay some or all of your Part B premium. So it just really varies.
Yeah. And again, so check your category, see where you fall, and make sure that you're making the most of your benefits and not paying more than you need to, regardless of which side you fall on there. Let's talk a little bit more about the coverage. So there's a lot of moving parts to Medicare.
Exactly.
How do you tell your people new to Medicare? How do you explain this to them?
So basically there's 4 parts of Medicare. You have your Medicare Part A, which is hospitalization coverage. Part B is physician services, so lab work, durable medical equipment, your doctor's appointments, and so forth. And then Part C is also known as Medicare Advantage plan, so that's optional. And then Part D is your prescription drug coverage, which is also optional to opt in as well, but I highly recommend it because there is another penalty that comes along with that if you do not choose a prescription drug plan.
Gotcha. Wow. So if you don't take a drug plan,
right,
the government's going to penalize you.
Right. So if you're one of those few and lucky people that are on no medications and you just don't feel or see the need to pay a monthly premium, we often suggest that you go on one of the lowest premium plans so you don't incur that penalty. The Part D penalty is 1% per month for every month that you do not have a credible prescription drug plan. And that is a lifetime penalty. It's not a one-time penalty. So you pay that penalty for every month that you have a prescription drug plan on top of your drug plan premium when you do enroll.
Penalties everywhere. Call Melissa and her team. What is going on? That's absurd. Listen, we don't say we agree with everything with the government, but we're really good at what we do. Melissa and her team are really good at understanding how this works and helping you avoid these costs that she's talking about, right? And that's how you want to make sure you're protecting yourself in this exposure by using a broker like Senior Healthcare Solutions. So we talked about penalties and we talked about IRMAA. I stole a little bit of thunder there. So let's get into the coverage options. So you just explained, how much Medicare costs and what it covers from the hospital and the doctors.
Right.
People on original Medicare, they're not covered 100%. So what are their options?
Right. So when you go on to Medicare covers 80%. Your A and B cover 80%. So you need to choose a secondary to pick up where Medicare leaves off. I always tell people when I'm talking to them that it's like Dorothy and the Yellow Brick Road. So you have one of 2 paths to choose. You can either choose a Medicare supplement plan or a Medicare Advantage plan. And they're, 2 completely different plans. I can take some time to go over those if you'd like.
Yeah, break it down, right? So how do we call it like an elevator. I got 60 seconds. How do you explain to someone the differences between a Med Supp and a Med Advantage?
Sure. So a Medicare supplement plan allows you to go see any doctor anywhere that takes Medicare. Basically, with your Medicare supplement plan, you pay a monthly premium, and depending on the plan that you have or the plan that you choose, you'll have either little to no out-of-pocket costs. So you know that you're paying a monthly premium every month. The flexibility to see whoever you want, wherever you want, no referrals, that kind of thing. And it just picks up where the original Medicare leaves off.
Sure.
Medicare supplement plans, it's important to keep in mind they do not include prescription drug plans. Now, Medicare Advantage plans on the other side, some people refer them as like a Medicare pay-as-you-go. Medicare Advantage plans typically have no monthly premium, but you pay for stuff as you go along. So you pay for doctor visits, you pay for so much per day for so many days that you're hospitalized. You're going to pay, sometimes for lab work, but CAT scans, MRIs, because you're not paying a monthly premium.
Can't my cake and eat it too.
Right. Medicare Advantage plans, it's important to keep in mind that they do replace your A and B. So if you're on a Medicare Advantage plan, you don't use your Medicare card anymore. You just use that Medicare Advantage plan. And some people think of them as all in one because most Medicare Advantage plans will include prescription drug coverage, some level of dental, vision, and hearing, and some other benefits as well.
I'd imagine that's why they're getting popular, right? These all-in-one style
Right.
plans, right? So you're seeing all the TV commercials and whatnot, and everything's free and everything's included.
Exactly. That's important to keep in mind, though, since you're not paying a premium for that Medicare Advantage plan. All Medicare Advantage plans have a maximum out of pocket. While they may not have deductibles like the commercial says, they do have what's called a maximum out of pocket. And the maximum out of pocket can range depending on where you live and if you're on an HMO or a PPO, which are the two most popular plans.
Gotcha. So at your team, though, right? Like you guys do both plans? I mean, it's not just one or the other?
Correct. We assist you in choosing which plan may be best. Maybe it's the Medicare Supplement or the Medicare Advantage. And if so, what the next steps we need to take. If it's a Medicare Advantage plan, we want to choose a plan that most all of your doctors take so you're not paying out-of-network costs. Or if you can even go out-of-network, depending, once again, if it's an HMO or a PPO.
So once someone chooses a Medicare plan, what happens every year after that? I mean, can they keep the plan? Are they stuck in the plan? Can they change the plan?
Your plans automatically renew no matter what, if you're on a Medicare Advantage or a Medicare Supplement plan. Obviously, with the Medicare Supplement plans, you have to pay your premium. I mean, they can drop you. If you want to change your plans, depending on which plan you have, Medicare Supplement plans can be changed at any time during the year. Medicare Advantage plans can be changed during the annual enrollment period from October 15th through December 7th. And that's why it's always great to work with a Medicare agent, especially my team, as we do those annual reviews with you, whether if you're on a Medicare Supplement plan, you get a policy increase, or the annual enrollment period has come up and maybe your doctors have changed, or you're just not happy with that plan anymore, or there's new plans in your area that you don't know about that may offer more benefits.
And that's something you said your team helps with every single year. So it's
correct.
Like, hey, I'm just here to sign up on every single year. Another reason why you need to work with Melissa and her team at Senior Healthcare Solutions. Over 25 companies they represent. They can help you with Medicare Supplement, Medicare Advantage, prescription drug plans, and everything in between. How can they give us a call?
You can give us a call at 866-MEDIGAP, 866-633-4427, or you can visit our website, seniorhealthcaresolutions.com, and schedule a one-on-one consultation.
Awesome. Well, thanks so much for joining and watching another video with Melissa and myself, and giving Senior Healthcare Solutions the opportunity to help you with your Medicare insurance.